Today, I'm going to give you so much information on vomiting, you're going to want to hurl. Y'all know me, I'm Dr. B, and this is The Buzz. Vomiting is a defense mechanism that we use to get whatever is offending the body out of the body. Unfortunately, it can be pretty excessive or go on long enough where the body gets dehydrated. It doesn't have enough fluids to function, or the electrolytes get out of balance. Those are the chemicals that make the body run, like sodium and potassium. Today, we're going to talk about how to keep your child out of the ER, what the signs of dehydration is, and what you need to call the doctor for. Vomiting in kids can have many causes. Most commonly, it's due to a viral infection, and these seem to happen more often during the warm weather and the summer months when school gets back into session, and that's when these viruses are out. So basically, right now. Sometimes vomiting can be due to food poisoning, eating bad food, overeating, or food intolerance, motion sickness, and there's various other infections that don't even have much to do with the GI tract, like urinary tract infections can make you vomit, or ear infections or sinus infections. And this is why we ask so many questions about vomiting to try to nail down what the problem is and where we should focus our exam. There are some serious causes of vomiting: gut blockage like appendicitis, intussusception, surgical emergencies like that. Head injury can cause vomiting, poisoning, or medication overdose. My point here is that vomiting is a very common symptom, but those serious causes are actually pretty rare. So there's no need to panic if your child is vomiting. Our tendency is when a child is vomiting to push fluids. We got to push fluids, get fluids into them. But when you do that, you end up distending their stomach. Kid feels nauseated and just throws up everything you just gave them. If you, as an adult, were nauseated or had been vomiting, you're not going to drink a whole quart of Gatorade. You're going to take a sip and you're going to wait. You're going to take a sip and wait. And that method is what we need to do with kids. It's very important when it comes to managing fluids for vomiting at home that you make sure you talk to your doctor about how they want you to give oral fluids. But this is what I tell my patients for most cases. First of all, remember to focus on giving small amounts frequently. I like to use an electrolyte solution like Pedialyte or Hydrolyte. These are a proper mix of water, sugar, sodium, and potassium, and they're easy to tolerate and absorb. I tell my patients to give 1 teaspoon of ice cold electrolyte solution every 10 minutes to start with. You don't want to give them a large cup and say, hey, just take a sip of this, because if a kid's thirsty, they're going to gulp it down and they're going to cry and fuss when you take it away, and that's probably going to make them vomit. So measure out a teaspoon of drink and put it in a shot glass or a medicine cup and have them drink the whole thing. Tell them to drink the whole thing, or use a syringe for smaller kids who can't hold a cup. If they keep that down, that 1 teaspoon every 10 minutes for a couple hours, then you can move up to 2 teaspoons every 20 minutes. It's actually the same volume over time, but we're just giving them a larger dose, a little less frequent. The goal here is to sneak fluids in without distending the stomach, keeping the kid hydrated and getting things going in the right direction again. If that works, you can continue larger amounts spaced out over larger periods of time. If at any point the child throws up, you want to wait 30 or 45 minutes and then start again at the first step. Don't try any solids until the child can keep down fluids for 12 hours. And they're going to be, oh, I feel so much better, I want something to eat. No, it's actually good for them to be hungry and have that empty stomach so that we can sneak in little bits of food. So when you start solids, again, we're going to give a very small, frequent meal. So a cracker, a piece of toast, a little bit of Jello, and then you wait. And then you give a cracker, a piece of, so you take a little bit at a time very frequently. When the kids feel even a little bit better, the first thing they want to do is go right back to their regular diet of French fries and chicken nuggets. But you need that stomach to rest, so start small, start with simple foods. After 24 hours, they haven't vomited, then you can try heading back to a fairly regular diet. But try starchy, easy to digest foods like pasta or rice, and stay away from fatty, spicy, greasy foods. Again, the French fries and chicken nuggets, which all the kids love, you don't want to go right back to that. Now, what I'm telling you here sounds a little bit like the classic brat diet, the bananas, rice, applesauce, toast diet. And yes, I know the research says the brat diet doesn't do much for someone who's vomiting, but I still recommend it over launching directly into a typical toddler diet right away. Sometimes if the vomiting just keeps going on, we will recommend using a medication. But these can't be used for every child. They can't be used for every situation, because sometimes something serious may be going on. You can't use medications in that case. So we're going to want to talk to you before we recommend using these medications. One medicine we use is promethazine or Phenergan. That is a suppository. It goes up the bum, which is great because they can't throw it up. The second one is ondansetron or Zofran. That comes as a dissolvable pill. Usually just put it in the mouth or under the tongue. It dissolves, so they don't have to swallow anything, which again is nice. And both of those help with nausea. If you have these around at home, please talk to your doctor before you use them. We don't want someone to have vomiting. They're just being doped up with these medicines and they end up having appendicitis or something. So if you have them at home, do not use them without talking to your doctor first. Now, when do we see a doctor? The most common reason you should take a vomiting child to the doctor is for dehydration, or if the vomiting won't stop, so the child's at risk for dehydration. And we'll talk about the signs of dehydration in just a moment. Blood in the vomit or bright green vomiting can be a sign of something a little more serious, so you're going to want to get that checked out. Severe abdominal cramping or pain, blood in the poop could mean a bad infection or a surgical problem, and a lack of pooping or gas passing. Again, that could mean there's a serious surgical problem. Now, that doesn't mean they haven't gone in 6 hours or 12 hours. It means maybe they haven't gone for a day or two, and that's been associated with this vomiting. We're going to want to get that checked out and make sure there's not some serious problem. And finally, a high fever. Sometimes that can mean, again, a more serious problem than a simple viral infection. Dehydration means there's not enough fluids in the body, or the electrolytes, the chemicals that make the body work, are not balanced properly. This can happen especially with vomiting because not only are you losing fluids and those chemicals, but you can't replace them because you keep vomiting. The signs of dehydration are pale, blotchy skin or extremities, sunken dry eyes, or maybe a sunken soft spot in the baby. Now, normal infants, if they're sitting upright, the soft spot may sink in a little bit, so don't panic if you see that, but it is something to watch out for. Dry lips or dry tongue, dry mucous membranes in the mouth and the cheeks. Their spit may look kind of sticky and thick. If the child is not making tears when they're crying, that can be a sign of dehydration. Decreased urine output. The child should be peeing at least probably every 5 to 6 hours, or if they have dark urine, that can be a sign of decreased urine output. A rapid resting heartbeat and poor energy. This can be subtle, but dehydrated kids often look like they just have zero energy. If these signs are occurring, the child may need to get checked out, most likely in an ER where the electrolytes can be checked and IV fluids can be given if needed. What about diarrhea? Well, a child has been vomiting, usually will have diarrhea a day or two later, and that's okay because it means the infection is probably past the stomach, starting to move into the lower intestine. It usually coincides with the vomiting slowing or stopping. However, if your child is having both vomiting and diarrhea at the same time, they're at a pretty good risk of having dehydration, so you don't want to watch them closely. We will be talking about diarrhea next Sunday, so you don't want to miss that lecture. As always with these talks, preventing spread of the illness is of utmost importance. Everyone needs to keep their hands clean. Kids should be cleaning under the nails, not chewing their fingernails or putting their fingers in their mouth. Anyone who's sick should be isolated. They should probably use a separate bathroom from everyone else. And please do not send a sick child to school or daycare because they're just going to get everyone else sick and it's probably going to come back to them and come back to your house. So keep them out of daycare or school until they haven't been vomiting for at least 24 hours, preferably about 48 hours. Thanks for watching today's episode on vomiting. Make sure to subscribe and hit that bell notification icon so you don't miss a single episode. We put out a new episode every Sunday at noon. Next week, we'll be talking about diarrhea cha-cha-cha. Won't that be fun? Y'all know me, I'm Dr. B, and this has been The Buzz on Parenting and Pediatrics. We'll see you next time.